In this slide, we will go over nutrition, food handling, and sanitation. Let's go to introduction. As a direct care staff person involved in helping residents with their daily activities, you will have a big impact on the residents' health through their diets. Eating a well-balanced, healthy diet will help the resident and you from catching an illness from a virus or an infection. When our bodies are well fed, we are able to fight off sickness. Residents of personal care home may have serious illnesses such as Parkinson's disease, heart disease, diabetes, cancer, or respiratory illnesses. Residents need regular and nutritious meals to balance medication and maintain proper body weight. So, what is dehydration? Water is absolutely necessary to life. It is found in all body cells and accounts for two-thirds of total body weight. Water helps the dissolving and digestion of food and in the elimination of waste products. It is found in all beverages and in many solid form foods. Many times people don't want to drink too much water because they're afraid they will have an accident or wet themselves. Also, the body's ability to detect thirst diminishes with age. This is a problem because residents need water to prevent dehydration. Dehydration occurs when a person is either not getting enough liquid, about 6 to 8 cups daily, or is discharging too much urine. Some of the signs and symptoms of dehydrations are headache, that is the most common symptom. Second one is dry mouth and tongue, cracked lips, dry skin, sunken eyes, nausea, vomiting, diarrhea, dark or strong smelling urine, weight loss, fast heartbeat, low blood pressure, confusion, lightheadedness, disorientation. Some medications can cause dehydration. Dehydration can lead to confusion, behavior problems, weakness, respiratory failure, kidney failure, and even death. So, as you can see, it is serious, especially for elderly. It is important to report possible dehydration to your supervisor when you see any of the above symptoms. Drinking water should be available to all residents at all times. If a resident has an impairment that affects their ability to drink water, you should encourage or assist them to drink some water often throughout the day. You will need to offer the resident water often throughout throughout the day and evening to try to coax the resident to drink. A resident may not feel thirsty even when he or she needs fluid. Without a constant flow of fluid, bacteria will grow in the bladder or urinary tract, causing infection. A resident should drink 8 glasses of water per day. A glass of cranberry juice daily can also help combat infection. Cranberry juice has a substance in it that makes it difficult for bacteria to adhere to the walls of the bladder and urinary tract. The bacteria are then flushed out in the urine. What is daily food intake? The daily food intake or meal plan is a guide for each resident to determine what food and how much should be consumed each day. 6 nutrients are supplied by food: water, protein, fat, carbohydrates, vitamins, and minerals. Protein, fat, and carbohydrates are the three that provides calories, which is the amount of energy or fuel in the food. There are recommended dietary allowances or amounts that are needed of protein, vitamins, minerals, and calories for each person to maintain good health. Residents spend most of their time sitting or laying down, so they don't need a large amount of calories. Eating healthfully. Nutritionally well-rounded meals include foods that have protein such as meat, poultry, fish, dairy products, and eggs. This is essential for the repair of tissue and for maintaining good health. People who are on vegetarian diet can still get some protein from plants, food like dried beans or peas, grains, and cereals, but they often require additional food to make their meals complete. If a resident has been diagnosed with heart disease, he or she may be kept on a lower fat diet. Again, it is important for you as a direct care staff person to know which residents are on a special diet so that you do not offer them food that is not allowed in their meal plan. A good balanced diet normally supplies enough nutrients for a person's daily needs plus some extra. It is recommended that the daily menu plan include the five food groups in suggested amount to maintain an individual's ideal weight. The five groups are the fruit groups at 2 cups per day, the vegetable group, meat and eggs and beans group, the grain group, and the milk or dairy group. Each serving could be a particular portion size. For instance, an ounce of grain is equal to half of bagel, a small muffin or a serving the size of baseball. A 3-ounce serving of meat is about the size of a deck of cards. A cup of fruit the size of a baseball would equal one serving. What to do if a resident refuses to eat certain food? The first thing you must do is determine why a resident is refusing to eat the food. It is because he or she doesn't like the taste of it or how it was cooked. Is the resident depressed? Has the resident's medication changed recently? Is it because of his or her cultural or religious beliefs? Specific food means different things in different cultures, but most cultural groups use food for similar purposes like celebration. There are times when eating certain food go against the residents' beliefs for similar purposes like celebration. There are times when eating certain food go against the resident's beliefs and he or she should be offered an alternative food choice. For instance, a person who practices Judaism may not eat ham or pork products. A vegetarian may need an alternative protein food other than meat. A resident may not be forced to eat food. As a direct care staff person, you must be sensitive to person's personal eating habits based on beliefs and not cause him or her to be embarrassed. You will learn more about different cultures and religion in the module called Meeting the Care Needs of Resident in a Culturally Diverse Environment. How do you make sure that the food served is safe to eat? This is where food safety becomes part of your responsibility during the service, storage, and preparation of meals. The most important food safety precaution is proper hand washing. Frequent and thorough hand washing before food preparation, before serving food, before assisting a resident with eating, and after food handling is important to prevent illnesses. As for storage of food, you must properly label food with dates when a food was prepared and when it was put into the freezer. You should follow the first in first out rule. In other words, the food purchased last should be put behind the older food on shelves in dry storage or in the cold storage so that the freshest is used last. Additionally, you need to check expiration dates on products such as milk and eggs since they are more likely to contain harmful bacteria than goods like breads and cereal. The other important items you want to check daily are the temperatures of the refrigerator and freezer units. If a food is kept above the temperature of 40 degrees Fahrenheit for many hours, it will spoil and could cause foodborne illness, especially in the elderly whose immune system are not able to fight food infections. Food kept in the home, including food in residents' bedroom, must be kept in a sealed containers. This is the end of this slide.